Welcome to the deep dive. Today we're going deep on something you specifically wanted to learn more about.
Oh,
Diabetic nephropathy.
interesting.
You've sent us some really fascinating material on this condition, and we are
Mm.
so ready to break it all down for you.
Yeah, it's something that I think deserves a lot more attention than it often gets.
Absolutely.
Yeah, when we talk about diabetes complications, kidney health is
Yeah,
something we need to be thinking about right from the start.
for sure.
Mm.
I think a lot of people, know that diabetes can impact your vision or your feet,
Hmm.
but the connection to kidneys might not be as obvious.
Yeah.
So let's just start with the basics.
Okay.
What is diabetic nephropathy?
Yeah.
And what is going on in the body when someone develops this condition?
The simplest way to put it is that it's essentially kidney damage caused by diabetes.
Okay.
Your kidneys are these incredible filtration systems, right?
Mhm.
Constantly cleaning your blood, removing waste products.
Right.
But when you have diabetes, high blood sugar levels over time
Yeah.
can damage those delicate filters in the kidneys called glomeruli.
Glomeruli.
Yeah.
That's the term I was trying to remember. I've heard that before, but I need a refresher.
So think of glomeruli as tiny bundles of blood vessels,
Okay.
each acting like a microscopic sieve.
Wow.
They allow waste products and excess fluid to pass through while holding back important things,
Okay.
like protein and blood cells.
So it's
It's a remarkably precise process.
precise.
And
Yeah.
when it's working correctly, you don't even notice it happening.
Right. But high blood sugar throws a wrench in the works, right?
Exactly.
Yeah.
One of the key mechanisms at play here is the formation of something called advanced glycation end products,
Oh, wow.
AGEs for short.
Okay.
These AGEs form when sugar molecules bind to proteins,
Mm-hmm.
and in the kidneys, they can damage the structure of the glomeruli, making them leaky.
Leaky glomeruli? That doesn't sound good.
Uh,
What are some of the signs that someone might be developing this?
Unfortunately, early on, there might not be any noticeable symptoms. That's why regular screening is so important.
Okay.
But as damage progresses, one of the first things you might notice is an increase in protein in your urine.
So those leaky glomeruli are letting protein slip through, and it ends up in the urine.
Exactly.
How would someone even know if there's protein in their urine?
A simple urine test can detect this.
Okay.
Specifically, they would be looking for a type of protein called albumin.
Mm-hmm.
If it shows up in your urine, it's called microalbuminuria,
Okay.
and it's a key early warning sign of kidney damage.
So regular urine tests are essential for anyone with diabetes, even if they're feeling fine.
Absolutely. Early detection is key.
Got it.
The sooner you know there's an issue, the sooner you can take steps to protect your kidneys
Right.
and slow down the progression of the disease.
Okay. Let's talk more about that progression.
Sure.
I know you mentioned that diabetic nephropathy is a progressive condition. What does that mean exactly? Does it get worse over time?
Unfortunately, yes, it can.
Okay.
It typically advances through 5 stages, and each stage reflects a greater degree of kidney damage. It starts subtly, but without proper management,
Yeah.
it can eventually lead to kidney failure requiring dialysis or even a transplant.
Wow. So we're talking about a condition that can go from silent to life-altering if it's not caught and managed early on.
That's why we're having this conversation.
Okay.
Awareness is everything.
Ah.
Understanding how diabetes affects your kidneys and knowing what to look out for empowers you to take control of your health.
Okay, so we've got the basics down.
Yeah.
We know that high blood sugar can damage those delicate filters in the kidneys, those glomeruli.
Right.
We know that this damage can progress over time if it's not managed.
Yes.
And we know that early detection through regular screening is critical.
Absolutely.
But what about preventing this from happening in the first place?
That's where things get really interesting.
Okay.
While there's no guaranteed way to completely eliminate the risk of diabetic nephropathy,
Right.
there are absolutely things you can do to significantly reduce your chances of developing it
Okay.
and slow down its progression if it does start.
Got it.
And that's what we'll focus on next.
Perfect. I'm ready to hear about how to protect those hardworking kidneys.
All right.
Stay tuned, listeners. We'll be right back after a quick break.
Sounds good. So before the break, we were talking about the importance of prevention.
Right.
And that's really where I want to pick up, because while the idea of kidney damage can be scary,
Yeah.
the good news is that there's a lot you can do to protect those kidneys.
Okay, that's what I like to hear.
Yeah.
Give us the good news.
All right.
What are some of the most effective strategies for preventing this or at least slowing down the progression?
Well, as you might expect, managing your blood sugar levels is absolutely paramount.
Okay.
We've talked about how high blood sugar is the culprit behind those AGEs that damage the glomeruli.
Right.
So keeping those levels within a healthy range is your first line of defense.
Okay, so that means watching your diet, getting regular exercise, taking your medications as prescribed,
Yep.
all the usual suspects for good diabetes management, right?
Exactly. And it's not just about feeling good,
Right.
it's about protecting your organs at a cellular level.
Mm.
Every time you keep your blood sugar within a healthy range, you're essentially giving those glomeruli a fighting chance.
It makes those numbers on the glucose meter seem a lot more meaningful,
Yeah.
but I know that even with the best efforts, sometimes blood sugar can still fluctuate.
Sure.
What else can people do to minimize the risk to their kidneys?
Another crucial factor is managing your blood pressure.
Okay.
High blood pressure puts a lot of stress on those tiny blood vessels in the kidneys,
Hmm.
including the glomeruli. It's like
Right.
constantly pounding on a delicate filter. Eventually, it's going to start to wear out.
So it's a double whammy. High blood sugar and high blood pressure are both working against those glomeruli.
Precisely. That's why it's so important to control both.
Hmm.
Work with your doctor to find the right blood pressure meditations if you need them,
Mm-hmm.
and make lifestyle changes to support healthy blood pressure,
Okay.
like reducing sodium intake and getting regular exercise.
So far, we've got blood sugar management, blood pressure control. What about smoking?
Oh,
I have a feeling that's not going to be good for those glomeruli either.
you're absolutely right.
Yeah.
Smoking is a major risk factor for diabetic nephropathy, just as it is for so many other health problems.
Right.
It damages blood vessels throughout the body, including those in the kidneys.
So it's like adding insult to injury.
Yeah.
You've got the high blood sugar and the high blood pressure,
Mm.
and then smoking comes along and just makes everything worse.
It's like throwing gasoline on a fire.
Wow.
If you're serious about protecting your kidneys, quitting smoking is one of the most impactful things you can do.
Right.
And it's never too late to quit your kidneys. We'll thank you for it.
Okay, so we've got the big three: manage blood sugar, control blood pressure, and ditch the cigarettes. What about diet? Does what we eat play a direct role in protecting our kidneys?
Absolutely. What you eat has a huge impact on your overall health, including your kidney health.
Okay.
For people with diabetes, it's especially important to pay attention to protein intake.
Okay.
While protein is essential, excess protein can put a strain on your kidneys.
That makes sense. If those glomeruli are already struggling to filter out waste products, we don't want to overload them with extra protein to process.
Exactly. Work with your doctor or a registered dietitian to determine the right amount of protein for your individual needs.
Okay.
And don't forget about sodium. A low-sodium diet helps manage blood pressure,
Right.
which we know is crucial for protecting those glomeruli.
So it all comes back to those tiny filters.
It does.
It's amazing to think that every choice we make,
Right.
from what we eat to whether we smoke,
Yeah.
can have a direct impact on those microscopic structures working tirelessly to keep us healthy.
It really highlights the interconnectedness of our bodies, doesn't it?
Absolutely.
Yeah.
But even with all of these preventative measures in place, is there still a chance that this could develop?
It's a great question.
And what happens if it does?
And it's something we'll explore in more detail in just a moment.
Okay.
Because while prevention is always the goal,
Right.
it's also essential to understand the treatment options available if it does progress.
Okay. We'll hold that thought.
Okay.
Listeners, stay with us. We'll be right back to delve into the latest treatments and research for diabetic nephropathy. Welcome back to the deep dive. Before the break, we were talking about what happens if, despite our best efforts, diabetic nephropathy does progress.
Yeah, it can feel overwhelming to think about.
Right.
But, I hope I can shed some light on what treatment options are available.
Okay, great.
It's important to remember that even if it advances, there are ways to manage it
Okay.
and maintain a good quality of life.
Mm-hmm.
Treatment approaches really depend on the stage of the condition
Okay.
and how much kidney function has been impacted.
That makes sense.
Yeah.
So let's start with the earlier stages.
Okay.
If someone is diagnosed with diabetic nephropathy early on, what are the initial steps in terms of treatment?
Well, in addition to those lifestyle modifications we talked about,
Right.
managing blood sugar, controlling blood pressure, and avoiding smoking,
Yeah.
medications often become part of the treatment plan.
What kinds of medications are typically used?
Two common classes of drugs are ACE inhibitors
Okay.
and ARBs,
ARB.
angiotensin the second receptor blockers.
Okay.
They work in slightly different ways, but both help protect the kidneys
Okay.
by lowering blood pressure and reducing the amount of protein leaking into the urine.
So even though these medications are primarily for blood pressure, they have a protective effect on the kidneys as well.
Exactly. They help reduce the strain on those glomeruli,
Right.
those tiny blood vessels we've been talking about, and that can slow down the progression of the disease.
It's amazing how all these systems are connected.
Yeah.
But what happens if the condition progresses despite medication and lifestyle changes? Are there other treatment options available?
Yes, there are. If kidney function declines significantly, dialysis might become necessary.
Okay.
Dialysis is a life-saving treatment that essentially takes over the job of the kidneys,
Wow.
filtering the blood and removing waste products.
So it's like an artificial kidney stepping in to do the work that the body's kidneys can no longer do.
That's a good way to think about it.
Okay.
There are different types of dialysis, but essentially
Yeah.
it involves using a machine to filter the blood and remove waste products
Okay.
that would normally be eliminated by the kidneys.
And what about kidney transplantation? Is
Yeah.
that an option for people with end-stage renal disease?
It can be, yes.
Okay.
A kidney transplant involves surgically replacing a diseased kidney with a healthy kidney from a donor.
Wow.
It's a major procedure,
Right.
but it can offer a more long-term solution for people with kidney failure.
So there are options available even in the later stages.
There are.
But I have a feeling there are still a lot of challenges and unknowns when it comes to treating this condition.
You're right.
Yeah.
While we've made significant strides in understanding and managing diabetic nephropathy,
Right.
there's still much more to learn, and that's why research is so critical.
Speaking of research, are there any new developments or promising areas of study that you're particularly excited about?
Absolutely. One area that holds a lot of promise is stem cell therapy.
Okay.
Researchers are exploring ways to use stem cells to regenerate damaged kidney tissue,
Wow.
essentially trying to repair those damaged glomeruli.
So are we talking about actually regrowing kidney tissue?
That's the hope.
Wow.
It's still in the early stages of research,
Okay.
but the potential is enormous.
Yeah.
If we can figure out how to harness the power of stem cells to repair damaged kidneys,
Right.
it could revolutionize the way we treat diabetic nephropathy.
That would be incredible. Are there other research avenues that you're keeping an eye on?
Definitely, there's growing interest in developing medications that target specific pathways involved in kidney damage.
Okay.
For example, there's a lot of research looking at drugs that block inflammation,
Okay.
which plays a key role in the progression of diabetic nephropathy.
So it's about going beyond just managing blood sugar and blood pressure.
Yes.
And trying to interrupt the actual processes that lead to kidney damage.
Exactly. It's about understanding the cascade of events that unfold at a cellular level and finding ways to disrupt those harmful processes.
I see.
And it's not just about new drugs.
Right.
There's also a lot of exciting research happening around lifestyle interventions,
Diet.
particularly around diet.
Diet seems to play a role in so many aspects of our health.
It does.
What are researchers learning about the impact of diet on diabetic nephropathy?
Well, we already know that a low-sodium diet is important for managing blood pressure,
Right.
but there's growing evidence that certain dietary components can have a direct protective effect on the kidneys. For example, studies are showing that a diet rich in antioxidants, found in colorful fruits and vegetables,
Okay.
may help reduce oxidative stress in the kidneys,
Wow.
which can contribute to damage.
So those vibrant berries and leafy greens are good for more than just our taste buds. They might actually be helping to protect our kidneys as well.
Exactly. And don't underestimate the power of exercise.
Right.
Regular physical activity not only helps control blood sugar and blood pressure, but also improves blood flow to the kidneys,
Okay.
which can help maintain their overall health.
It's like giving those glomeruli a little boost with every workout.
Yes.
It's amazing to see how research is constantly uncovering new ways to prevent and manage diabetic nephropathy.
It really is an exciting time. The more we learn about this condition, the more empowered we are to take control of our health and protect our kidneys.
Well, this has been an incredible deep dive.
It has.
We've covered so much ground, from the basic mechanisms of diabetic nephropathy to the latest advancements in research. I had to say, I feel a lot more informed and honestly a lot more hopeful about the future.
I'm so glad to hear that. Remember, knowledge is power.
It is?
The more you understand about this condition, the better equipped you are to manage it and make informed decisions about your health.
Absolutely. And to our listener, we hope you feel the same way. We encourage you to continue learning,
Yes.
to stay engaged with your healthcare providers,
Right.
and to never hesitate to ask questions.
Absolutely. Your health is worth it.
It is.
And we're here to support you every step of the way.
Thank you so much for joining us on this deep dive into the fascinating and complex world of diabetic nephropathy.
My pleasure.
We hope you've learned something new and feel empowered to take charge of your kidney health.
Absolutely.
Until next time, stay curious, stay informed, and stay healthy.